Hi, I'm Bob Ray Sanders here with Cynthia Allen, and we're taking sides today on the Ebola scare. Is it a scare?
I certainly think it's a scare. It's a scare to people here in the United States, but it's also it's a worldwide issue. I mean, President Obama said a number of weeks ago what an important issue this was. That it's a serious security threat, and he also ordered 3,000 troops, just several weeks ago, to West Africa to help combat this problem. So it's a very serious issue. I think you've got leaders on both sides of the aisle who are saying that, and so. I think people are right to be concerned. This is obviously a disease that's deadly that we know very little about, and so I don't blame people for being concerned.
Well, I don't blame people for being concerned either. I do blame people who are fearmongers on this, who are suggesting that we are in much more danger than we actually are based on what we're being told by the medical community. And it does bother me that there are those who are saying that we shouldn't send troops or that we should have a travel ban. I think that's crazy.
Well, there aren't a lot of policymakers who are saying that we shouldn't send troops. In fact, a lot of policymakers,
Rand Paul,
a lot of policymakers.
He's running for president.
John Boehner. We don't know if he's running for president, but John Boehner lauded the efforts of President Obama after he ordered the troops and said that he wished that he'd done something sooner, and perhaps we should have. But regardless of that, I think most reasonable people have legitimate concerns about this and feel like it's the government's responsibility to figure out how to address it. Unfortunately, there's not a lot of trust in the government because several weeks ago, President Obama said in the unlikely event that it comes to the United States, and then no sooner it did come to the United States. He did announce yesterday some additional travel screenings at United States airports, which will be implemented. And I think that should ease some more concerns because we can't control what happens at the airports in West Africa or Europe, but we can control what happens in the airports here. So I think that's a good step.
And let's keep in mind that, yes, it did come here in the form of one case. And we are dealing with that one case. I mean, the public response, the public health response to this issue seems to have been good.
Well, there were initially some issues with the hospital here in Dallas that actually turned away this gentleman who's contracted the illness early. And so that was an error that the hospital had admitted. And I think that initial error caused a lot of people to lose their confidence in the system.
Well, I mean, they didn't know, and I don't fault them necessarily. I mean, I think they should have caught it. The protocol was in place, and they just didn't follow the total protocol. But we have public health people out there telling us that this disease cannot be caught easily. You can't get it easily, that we should calm down and let the public health system work and do what it's supposed to do. We still have only one case.
It's true. It's true that we know how the disease is spread. However, there are a lot of things we don't know about the disease. For example, we don't know how long it can live on a surface. And even the CDC director, as late as this weekend, said that's something we don't know. And so there are lots of questions. It's an unknown. It's not like the flu. It's not something you know how to prevent it. You can go get a flu shot. It's a very acute illness. It has a very high kill rate. So people have every right to be worried about it. But I think we probably should have a little more faith in our institutions than we are exhibiting right now.
Well, I'm glad you brought up the flu because, I mean, tens of thousands of people die each year in this country from the flu. And we should be more worried about that than we are about single Ebola case.
But we know you can go get a flu shot, and we also know what the symptoms are. And the reason that the flu kills so many is because it tends to hurt people who are either young or old or who already have compromised immune systems. So we know how to deal with something like the flu. Ebola is an unknown, and that's why it's scary.
Well, unfortunately, it's going to be unknown for a while to come, and we'll keep paying attention to it.